So, I'm really delighted to host today's panel on health equity. My name is Kerstin Hoppe. I'm the Senior Vice President on Marketing and Communications of Roland Berger, a global strategy consulting firm. We're here today to discuss gender equality in health and to raise some of the following questions. Are women's health issues adequately addressed? Where do we see gaps? And most importantly for today, how could a moonshot look like? When looking at the statistics, well, women typically outlive men. According to the World Health Organization, the global average life expectancy of men is 71 years old, of women 76. So why do we need to talk about health equity and health equality really when women typically outlive men? Because there are a lot of issues. Just to name some. Women, compared to men, face health issues unique to their reproductive system. According to the latest study of the UN agency, and this number really struck me massively, every day 800 women die because of maternal issues. That's every 2 minutes, one woman, and thinking about a panel of 13 minutes, 15 during this panel only. So this is a severe issue. Another topic is that there is a clear evidence that female issues are underrepresented in what we call research. They are not sufficiently addressed. We have a lower number of clinical trials, of females in clinical trials, and as well, when it comes to the research and doing the research by gender, this is often not addressed adequately. And last topic here, women generally face persistent barriers to accessing healthcare due to gender discrimination, lack of education, or even domestic violence. And all of this clearly shows that there is a necessity to talk about gender equality in health. And that's why I'm super happy to have the chance to discuss it today with an amazing group of panelists. And let me ask the panelists on stage today. First of all, I have here Daniella Foster in the first row. Please come on stage. Daniella is Executive Board Member and Senior Vice President, Global Head Public Affairs, Science and Sustainability at Bayer's Consumer Health Division. Besides numerous other board mandates, Daniella is also board member of the UN Global Compact Network in the USA. And chair. Then we have Carrie Scott. Carrie is the head of ESG Management Office at Novartis. She serves at the Executive Council of Conference Board European Corporate Responsibility and Sustainability Council and is also a board member of the UN Global Compact Network, this time in Switzerland and Liechtenstein. And finally, we have Neema Kaseje. She's a humanitarian surgeon and health leader in Médecins Sans Frontières, so from a different angle. Neema is an expert in strengthening health systems in rural and refugee contexts. Beside her numerous fields of activities, she's committed to global health equity and improving access to surgical care. So thank you for being here on stage. Neema, really, I would like to have the first question to you today. So first time we spoke last week to prepare this panel. You have been in the middle of a refugee camp. Can you describe how inequality in healthcare can be experienced specifically in this kind of environments?
First of all, it's a privilege to be here, and thank you so much for the opportunity to share my perspectives. I've been working in Kakuma refugee camp since 2018. It's a camp that has a population of close to 300,000. We're seeing more displaced populations. We've reached the devastating milestone of 100 million displaced people all over the world, secondary to the war in Ukraine, secondary to multiple wars in sub-Saharan Africa and what's happening in the Middle East right now. And it's the women and children who flee. So looking at the patients that I would take care of, 70% of those fleeing war, conflict, persecution, climate disasters are women and children. And they're fleeing to places where health systems are almost non-existent. In where I'm working right now, there are very, very few doctors, very, very few nurses. The infrastructure is poor. Sometimes I have to do surgeries without lighting, and we're using our cell phones so that we can see what we're doing. Sometimes there's no water, so the basic infrastructure is just not there. And there's no financing, although right now we're trying to implement health insurance coverage, and that will benefit women. And so what I see from my perspective, the challenges are great. Women and children are the most vulnerable, and they have the least access to health. And health is a human right. It's a fundamental human right, and it is cross-cutting. Without health, you cannot be economically productive. You cannot go to school. You cannot protect your environment. So health is fundamental, and women and children do not have access to it, particularly in these difficult contexts. And so there's a lot of work to do, but I'm also hopeful that together we will make a difference.
Thank you. Daniella, maybe next question to you. So we are here at WEF, which is a huge and massive conference, but I saw you did head to COP as well. What do you think? Are women more affected or differently affected compared to men by climate change?
Yeah, so we talked to, I think you heard a little bit about this earlier. If we look at the global access gap to health, we have 1.9 billion women without access to preventative care. And actually, half of the world's population doesn't have access to basic and essential health services. When you take that and you then overlay that with climate, whether it's droughts, it's floods, it's migration, et cetera, we see that women are on the front lines of this, women and children. And they're on the front lines of this with the backdrop of already a lack of infrastructure, already a low resource environment. And so this space of how we expand access is one of the things that keeps me up at night. I do think that there is a lot we can do, and we'll kind of dig into that, but absolutely they're on the front lines. And if I just think about the panel earlier, it's interesting, I was at a dinner last night that was equally men and women, and each table was asked to come up with one thing that they think would help change the world. And one table on their own independently said, we should put our wives, our mothers, our daughters, basically more women in charge. And this kind of flow of resource and access gap is a big issue, although it is one I think we can solve, and we'll dig into that.
Okay, thank you. So already a little bit of hope here. Carrie, you are working with Novartis. So from the angle of the pharmaceutical industry, which issues are you tackling? So we heard already on a little bit of on the ground problems about access, about climate. So what is your angle from the pharmaceutical industry?
Thank you very much, and thank you for providing this platform. And it's a really great room. I wore extra layers of clothes. It was getting hot in here, so it's nice to see everybody here. And thank you. No, I'm working at Novartis here in Switzerland. I just took the train, so that was quite nice. And Novartis is a very big pharmaceutical company, so we're working in many areas, breast cancer and multiple sclerosis and global health. We have a huge malaria, anti-malarial work. We have some of the biggest research and manufacture of anti-malarials is done by Novartis. We're working in a lot of spaces, but one of our biggest therapeutic areas is also the biggest killer of women. Do you know which area this is?
Heart diseases.
Oh my gosh, was it the lady in red? No, yeah. The lady.
I lost my
Yeah.
mom to misdiagnosis of heart disease because she didn't have the typical male symptoms.
Okay,
In
there.
5 minutes.
Yeah, I'm so sorry. Yeah. So that's what I was going to say. There is a big gap in cardiovascular disease treatment between men and women. It's the biggest killer of women. Most people think, oh no, that's something men get. It's the biggest killer. Why is there such a gap? There's many reasons. Misdiagnosis, not enough women in the clinical trials. Women don't turn up with the same symptoms in the clinic. Women don't go to the clinic fast enough. They have pain, experience pain differently. And these gaps in healthcare are very important. And what we're trying to do is look at not only the science behind the molecule, but what are the other determinants of health, and how can we be a part of the solution instead of part of the problem. And one theme that I really feel strong about this, it sounds very boring, by the way, is about being systematic, about being long-term commitments, about not having extra projects on the side, but really embedding these lenses into how we do business, how we work, how we make decisions, not extra things. And that's why we have a special, how we do it is we embed the topic of access to medicine into how we work. Whenever we launch a medicine at Novartis, it has to launch with an access strategy to reach more underserved patients no matter where they live. To reach more underserved patients. What we try to do is maximize our social impact.
Can you explain how it is done? So especially the angle how you make sure when you want to measure things that you reach this goal?
Yes. So this is the traditional way in pharmaceuticals is you get an asset, you spend years and years trying to develop it, a lot of money, and then you launch it where you make the most money. That's how it works, simply. We look at it differently. We say, where's the disease burden? And what's our role in what's the use, by the way, of spending 10 billion a year on research and development if you can't get that innovation to the people who need it? What's really your purpose? So instead, we look then at where is the disease burden, and then how do we increase our social impact? The pharmaceutical industry is great because we have an inherent social impact. We make medicines that improve and extend people's lives. That's an inherent social impact. Our challenge is how do you maximize that? So we look at the disease burden, and we look at then the barriers to health and figure out what can we do ourselves or with others in the healthcare system to eliminate those barriers.
Okay, so talking about exactly the impact and not the profit. This is what I heard.
Exactly.
Okay, good news. Daniella, from your experience, what are the biggest obstacles that need to be tackled and to be overcome when it comes to health equality?
Yeah, so I think there's 3 big things in this space. One is around funding, and I'll unpack that a bit. The second is around access, and the third is around partnerships. So on the funding part, if I just think about my experience with Bayer, one of the reasons I joined the company is because of our heritage in women's health. So we created the first birth control pill. And when I joined, I came in because of this focus on women's health. So one of the things that I think is incredibly important is to actually have funding into women's health. So that's everything from your research and development in your innovation pipeline on through to venture capital and investment in women's startups, investment in women's health, on through to research and clinical trials, which we know is a big issue. And to unpack a couple of these things, if you were to look at venture capital investment in women's health in the early 2000s, 2006, it was 143 million. 143 million. That's all that was invested in the women's health space. If you were to look at it in 2022, it was over 1.8 billion. So I do think that there is a shift in terms of the proposition around women's health. Over 50% of the population, when we look at healthcare decisions and healthcare purchases, 80% of those decisions and purchases are made by women. So there's a clear business case here. So I think the funding part is absolutely critical. And if I think about our end, one of the things I'm excited about is actually the work that we're doing on menopause. So for all the women in the room, I can guarantee you if you live to older age, 100% you're going to go through menopause. The flip side of that is if you were to look at the National Institutes of Health's kind of key 300 issues, you wouldn't see menopause anywhere in there. And we know it has over a $1.9 billion impact just on workplace productivity. But you rarely even hear it talked about. So I do think funding matters. We have an innovation in the pipeline for menopause that I'm incredibly excited about. It's in stage 3 trials, and I think it will be pretty groundbreaking for women. So I think the funding piece is key. The second piece is the access piece. Which I also think is essential. And I think similar to what was talked about before, one of the reasons I came into Bayer was to tackle this access piece. So we have an initiative to provide access to family planning and modern-day contraceptives for 100 million women in low and middle-income countries. And we know that this kind of family planning and access piece is critical. We partner with the Gates Foundation, we partner with UNFPA. This is an essential unlock for women. So that kind of gets me a bit to some of the other pieces that I think overlay with health. There was a talk about social determinants of health. Where you live matters. Whether you grew up in Madrid or Mumbai, your social determinants of health are going to be different. And so I do think this access piece coupled with the personalization piece is really important. And we see this even in things like smallholder farmers. 50% of smallholder farmers around the world are women. So we have a big initiative to improve their livelihoods. And that's in partnership, which gets me to the third piece, which is when I think about the 1.9 billion that don't have access to preventative care, no one organization or entity can do it on their own. This has to be a collective action play. This has to happen in partnership. Private sector, companies, NGOs, governments working together. That is the only way to tackle these big, big challenges. But I think it can be done. Even when I think back to what I was just talking about around access to contraceptives or even improving the livelihoods of smallholder farmers, you have to create an ecosystem around that. You have to do it in partnership, and that's what we do. So on smallholder farmers and providing access to more nutritious food and those kinds of things, we partner with the International Finance Group. We partner with NetAffirm. That partnership piece is essential because what we're trying to tackle is an ecosystem challenge. But I do think we can get there. So I think the funding part, the access part, and the partnership part, that's the kind of the 3-part roadmap.
Okay, thank you very much for your perspective here. Neema, looking into your work a little bit and what you have achieved already and reading through, by the way, highly recommended your articles on social media, LinkedIn and X and so on and so forth. What really is amazing is, yes, you are going where the issue really is, but you seem to build up always as well an ecosystem that helps the people being stable in what you have started. Can you explain us a little bit more about the way how you are working and what you do to make it sustainable?
Sustainability is a critical piece, and that is often not addressed in the humanitarian sector. Historically, we've tended to fly in, try to solve the problem, and fly out. And we've talked about this being an ecosystem. And so to have a health system up and running, you need the healthcare workers, you need the equipment, you need the infrastructure, you need the water, you need the lighting. You need people to be able to trust you that you're going to provide them with good quality care so that they come to you, because you can have a perfect hospital, but if there's no trust and no demand for your services, there'll be no access. So when I think about access, it's really at the community level, with the community believing in what you're doing and trusting you. And then at the health system level, it is critical to have a trained workforce. It's important to have the supplies, the drugs that you need, so that you make the diagnosis and you're able to treat them, going through the whole continuum. It's important to also to have all the basic things that are needed so that you can provide good quality healthcare. So those two go in hand, the community and the people that you're serving, and then also the health system that needs to be strengthened so it can serve the needs of the people. And then financing comes into play. Because historically we've depended on donations, and that's not sustainable. And when COVID happened, we saw a lot of donations basically just go away. And we had to rethink, well, how do we make these interventions, including the surgeries that I do, how do we make these interventions sustainable? And so one thing that we're doing now, following a policy change that is now including refugees in the National Health Insurance Fund, is that we're going to ensure every single child who needs health and who needs surgical care. And as a result, we'll be able to bill for the services, and as a result, we'll be able to pay for more supplies, more equipment, pay for a workforce to strengthen the health system and to make that intervention sustainable over time. And that is really critical. And so one piece that has really propelled us forward is the policy change and government action, government having regulations that allow you to carry out health interventions and to improve access.
Can you specify this maybe? What exactly do you mean? So policy change, yes, but
yes. So
maybe most of us are being raised and living in very well mature health systems. So your daily life is maybe a little bit different.
Yeah, so it's for instance, I did some work in Nicaragua, and the first lady in Nicaragua at that time said, I want zero maternal deaths. And that was the message at the top, and it came down. So when I was working in the district hospital there, they were doing a lot of cesarean sections, and part of it was, we do not want any maternal deaths. And so that is that leadership, governance, and making it clear what the objective is. And the objective at the top needs to be equity. It needs to be, we want to protect our women and children. We want our women and children to survive. And these disparities begin very early on. If we look at new HIV infections in sub-Saharan Africa, it's in adolescent girls. All the new HIV infections are in young girls in sub-Saharan Africa. So we need to begin very, very early on, not just later on when they begin to have babies, but really in primary school, in grade school, to teach them leadership skills. During COVID-19, we saw teenage pregnancies go up, including in rural Kenya. So then we implemented a leadership program for girls to teach them, well, you need to be assertive. You need to be able to negotiate what you want. You need to have a vision for your life. And after that intervention, we reached about 600 girls. None of them got pregnant. Right? And so that is what we need. We need to make sure that we're equipping our young girls, and very, very early on, with the tools that they will need to negotiate a very tough world. It's really tough, and some of the progress we've made are being reversed in terms of our rights as women.
Okay, so education plays a big role, and as well, yeah, well, we heard about kick-ass statements and being bold and bold visions, as we heard. Thank you for this angle. Yeah, coming to maybe what we are here for, so drawing the equality moonshot. And Daniella, what, in your perspective, and this question now goes to all of you, what is necessary to kick this moonshot off? Is it something we heard here already? Is there any aspect we missed? Do we need somebody, in your opinion, to lead the pack for a moonshot, like the first moonshot going to the moon? We saw a person doing it. What is your opinion? What does it need?
Well, the good news is I think that Moonshot for Women's Health will be easier than that first going to the moon, right? These are things we can do. I would go back to what I said earlier, right? I think you need funding. You need first movers. You need a group of first movers that will come in and say, yes, we're invested in women's health, and this is what we're going to do about it. I also think everyone can come to the table with what they do best. A great thing that was just brought up is policy. I do think policy matters. Smart policy is also a big play. If I think about what we do around women's health, we do a lot of work with partners around antenatal care. How do you improve the antenatal care guidelines so you can tackle maternal health? There are smart policy solutions for this that will unlock access, which is kind of that second point I had before. And then the third thing is we absolutely have to do this in partnership. Health is all we have. I think we all really learned that during COVID. And so coming together on public-private partnerships, coming together for a moonshot, coming together across that continuum around funding, around smart policy, around place-based care. I think that's the last piece that's important to this is we need to rethink where health happens. If you're lucky, you get a couple of hours a day or a year with your doctor, but the rest of the year, there's a self-care component of this. Okay. So community and place-based is also big, and we need to bring in community health workers. So
okay, and as our clock is already blinking in red, I'll pass it on to Carrie.
Thank you. I think Daniella had some great points. I would just add one additional idea, which is about women leadership in healthcare. And we know that healthcare is foundational, leads to economic prosperity and growth. Women are, I love this idea that women are the chief medical officers of their families. I love that idea. But you know what? 80% of frontline healthcare workers are women, and only 15% are decision makers, senior managers. And I love this idea by Melinda Gates that it's not just about empowerment, but giving women power. And I think here we all have a role to play in giving women power in this space about mentoring, lifting up women, making sure women are in leadership positions in health. And I think that will be a key to a moonshot.
Thank you. And then your famous last thoughts on this, Neema.
I would add on the youth piece, really getting to our girls very, very early on, and giving them the skills that they need to be able to navigate a very tough world. Giving them access to mentorship, and beginning very, very early on, and making them leaders from the beginning, so that we have a solution that is transgenerational, not just us, but we're making sure that the next generation that is likely to see more challenges than my mom, for instance. And so that would be the one additional element I would add on, is to really bring in the young girls and make sure that they're well equipped to navigate this world.
Thank you very much. So hopefully this was an inspiring panel for you. Daniella, Carrie, Neema, thank you very much for this bandwidth really of topics, from very basic, fundamental, life-saving topics till a very important topic like menopause, which yes, affects hopefully all females when they are getting old enough. So if you feel inspired, let's keep it the most trending event at WEF, yeah? So we heard about hashtag Equality Moonshot, and please tag World Woman Fund to keep the spirit on, to keep the discussion rolling, and to get the moonshots done. Thank you very much.